The great 19th century philosopher Ralph Waldo Emerson once said, "The first wealth is health." Indeed, in the right scale of preference, good health is to be desired above fame or riches. For Governor Muhammadu Inuwa Yahaya of Gombe State, providing quality healthcare is more than a political promise. It is a solemn pledge backed by vision, courage, and competence. When Governor Yahaya assumed office on the 29th of May 2019, his very first move was to visit the Gombe State Specialist Hospital. What he found was heartbreaking: dilapidated infrastructure, unmotivated staff, patients treated on bare floors with torchlights because of unstable electricity. A needs assessment survey early 2019 had already painted the grim picture. Gombe's health sector was in a state of collapse. But rather than cause the darkness, Governor Yahaya lit a candle, declaring a state of emergency in the health sector. The transformation began with a bold overhaul of the specialist hospital. The old accident and emergency unit was demolished, replaced with an ultra-modern complex featuring theaters, pharmacies, consulting rooms, and amenities befitting a modern hospital. Accommodation for house officers and resident doctors followed, which helped facilitate accreditation for resident training. It did not stop at housemanship training only, but due to the improved infrastructure, residency training accreditations were also obtained in the family medicine and obstetrics and gynecology. After 20 years without any significant upgrade, the Gombe Specialist Hospital has regained its pride of place in the Northeast.
This place, initially it was not like this, but when he renovated the entire hospital, he built off an accident and emergency complex unit, renovated all the staff quarters. You can see how he's also going toward the welfare of the hospital staffs. Okay, and the entire hospital is renovating the entire hospital. So it has actually transformed the hospital. It was not like this before. Now our patients, the place is looking well, clean, and moreover, he supplied equipment, very sophisticated hospital equipment that are here. Is also supplied by His Excellency. So he has really done well, and it has actually transformed. Even the services is not like this before, but now there is much more improvement.
Then came the global pandemic, COVID-19. Like the rest of the world, Gombe was shaken, but skillful leadership turned fear into resilience. The emergency brought the best out of Gombe.
Both primary and secondary healthcare facilities are being focused on. We are accessing very soon facilities from the central bank to work on the remaining secondary healthcare facilities. And I think with what we did, we cannot cover all, because Gombe has, I think, 628 primary healthcare centers, but it's not in the numbers. Our focus is to have at least one functional primary healthcare center in each of our wards, 114 of them, that can work 24/7. And we are close to achieving that. And with what we did in the specialist hospital, you don't need any more testimony. You can go around and see for yourselves.
A brand new molecular laboratory was built. Experts led the fight, while the governor himself coordinated community engagement, fearlessly leading from the front. From crisis came reform. New agencies and initiatives reshaped the system. The Primary Healthcare Development Agency was repositioned. The Gombe State Contributory Health Insurance Scheme Go Health was launched, shielding families from out-of-pocket expenses. In less than 5 years, Go Health has enrolled over 400,000 beneficiaries. The Drug Management Agency GODMA ensured affordable, quality and medication across all facilities. Gombe had the unenviable reputation as the only state in the federation without a hospital management board. Governor Yahaya did not just inaugurate the board, but restructured and empowered it for improved supervision, accountability and staff motivation. These reforms would have been impossible without the political will, social capital, and commitment demonstrated by the current administration, which placed health at the center of its priority agenda, as highlighted in the Gombe State 10-year development plan. The backbone of public health lies in primary healthcare centers. Governor Inuwa Yahaya's administration built new primary healthcare centers and renovated existing ones, ensuring that all 114 wards have a functional primary healthcare centers equipped with solar power, reliable water supply, and improved facilities. From Barrow Nasarao in the north to Filia in the south, testimonies abound. Patients' visits have more than doubled, thanks to insurance coverage and better facilities. With 3 billion naira earmarked for further upgrades, the future looks even brighter. With World Bank support, 169 health facilities, including 103 PHCs and 66 clinics, were also upgraded. Solar power, staff quarters and water supply now supports maternal and child care across rural areas. Governor Inuwa Yahaya's invitation to Chatham House in 2022 is a testament to his commitment to drive Gombe towards universal health coverage. Secondary healthcare was not left behind. General hospitals in Bajoga and Kaltungo were completely turned around. Rising like a phoenix, Kumo General Hospital was demolished, then rebuilt from ground up. Recognizing this investment, President Bola Ahmed Tinubu approved its conversion into a federal medical center. The people of Akko rejoiced, celebrating a facility that promises care for generations to come. No health system thrives without skilled personnel. A brand new school of nursing with capacity to train 600 nurses and auxiliary staff, an unprecedented boost for the state. Gombe State University has also expanded intakes of medical and pharmaceutical students, ensuring a steady pipeline of professionals. Scholarships are also awarded to indigenes of Gombe State studying medical-related courses in tertiary institutions to train manpower. Over 400,000 residents are already enrolled under the Gombe State Contributory Health Scheme, protecting families from financial ruin and ensuring access to both basic and advanced care.
I myself am a retiree. I have nothing. If I'm sick, no, the Go Health will assist me because I don't pay any kobo. That is the essence of the government, to help the weak people, especially we that have retired, and also all women, all men who are farmers but they don't have any access to get medication. So they have really done a lot. For myself, especially, I started this getting the benefit of this Go Health since 2023 up to date, and I'm benefiting it.
Whenever we are sick, I and my entire family, this is the hospital we always come to. The doctors and nurses are really trying in giving us the best treatment. I came in this morning with eye problems, and immediately I was treated, and now I can go home.
Bayan da na haifu, hawan jini ya zo, an mun jinya sosai, na samu sauki, na samu lafiya. Wannan kuma haifuwa na biyu kenan.
After I put to bed, I had high blood pressure. I was treated and I recovered. This is my second delivery, and both of my children and I are registered in Go Health. We are all getting the best treatment we need. Drugs and treatments are free.
At the presidential villa in 2024, Governor Inuwa Yahaya was honored as the best performing governor in the healthcare delivery at the National Excellence in the Public Service Award. The Pharmaceutical Society of Nigeria found a reliable partner in Gombe. The immediate past president was full of commendation during the 2023 AGM, which Gombe State hosted. Between 2019 and 2023, the state's child mortality decreased from 95 to 83 deaths per 1,000 live births. Under 5 mortality dropped from 189 to 157, and infant mortality also decreased from 104 to 81 deaths per 1,000 live births. The reforms have earned national and global recognition. Donor partners, federal agencies, and the Bill Gates Foundation have applauded Gombe's success.
Partners who understand the delivery, the way that we can work and help government. Government in the long run has the responsibility for all of this work. We're there to accelerate these systems. It's very exciting that if you improve health, it actually accelerates the economic growth of the country.
As it is today, coverage of immunization is around 50%, and access, that is to primary health care, has also increased because now we have about 45%, and besides that, we equally have all the infrastructure needed around the health sector.
Recently, a letter of recognition and appreciation was sent in by Bill Gates, appreciating the giant strides of Gombe State in improving healthcare outcomes.
Army and the local government of maternal and child health, we want to focus on the issues of frontline health workers because you are an exemplar in how that has been managed. So we want to understand, but we also want to support you more. And I also want to appreciate the Gates Foundation for really coming along with us in this journey. I know that the foundation was looking at, okay, where are things happening differently, positively, even if there are challenges. I think there are a lot of innovations that Gombe State have done that we can learn from and we can share with others.
To build on successes recorded, review challenges and explore global best practices to improve its health sector, Gombe State government brought together top policy makers, development partners, global experts and health professionals in the first ever Gombe Health Summit. Nigeria's First Lady Senator Oluremi Tinubu declared open the summit, where the Gombe State Health Policy document was adopted. It was clear that the guests were impressed by the giant leaps achieved by Gombe in the last 6 years, but the strategic policy announcement by Governor Inuwa Yahaya on full implementation of wage structure for state health workers stole the show.
From revitalizing our primary health care centers and modernizing our secondary facilities to establishing Go Health Scheme and Go Pharma represent the deliberate creation of a seamless, comprehensive healthcare ecosystem in Gombe State. This integrated system is designed to deliver quality care from the primary to the tertiary level, ensuring that no one is left behind. And by the grace of God, we shall attain that with the operation of the Federal Medical Center, FUMO, and the Federal Teaching Hospital, which the federal government is directly supporting and funding, and which are being expanded by the day. To strengthen our commitment to the welfare of health workers that power this system, I am pleased to announce the immediate approval for the full implementation of CONMES and CONTEST salary structures for all health workers effective November 2025. Making them at par with that of the federal government. This significant intervention is financially going to cost 253 billion naira monthly on top of the payroll of Gombe State, and that translates to 3 billion naira annually. In return, I call upon all health workers in Gombe State to match this commitment with renewed dedication, higher standards of productivity, and an unwavering focus on contributing to the health and well-being of the people. We delayed paying convents and convents for several reasons. Ordinarily, if you pay salary in a situation where there is no environment for them to go and do the work, it turns out to be a useless venture that will yield no result. But at this point in time, we've done the basics, and I believe that complemented with efficient and effective service from the workers will boost the healthcare system in Gombe State.
Our governor, our host today, the governor of Gombe State, His Excellency Alhaji Muhammad Inuwa Yahaya. By the way, Mr. President sends his regards and love to you. And he said a good job. And for what I've done, just a few minutes, I can attest to that. I want to really commend the government for transforming the health sector in Gombe State. I know it's the usual statement to say a healthy state or a healthy nation is a wealthy one. And you've done that. And you said today that health is no longer just a necessity, but a place where you can enhance productivity, if I heard you right, prosperity and human dignity. And I believe you've captured all of this. And I say welcome and progress to this one. I heard all the transformative and transformational trailblazing strides that you have taken in the health sector. I can't begin to read them into the primary health centers that you have increased, or the various hospitals that, the state hospitals that you have put in the 3 sectorial districts. I listened how you wanted to even enhance nutrition in children through homegrown approach, and also producing pharmaceuticals too. Is that not what I think I heard a lot? You have so much robust agenda for the health sector, and I can't help but applaud you today. You've done so well, and it's just very sad for me to just come in and just leave without really having the opportunity to look at the various approach and strategy you want to use to move your state forward. To what I've learned so far today, even Bill Gates attested to that. He said he was impressed by his problem-solving mindset and commitment to achieving results. And we see that today, and we say we are really proud, and I believe that Mr. President is also proud of what you're doing. And also increasing salaries, it's really wonderful. And most people didn't realize that the state allocation has been tripled. And you are really putting yours to very, very good use. And I believe that's why when I told Mr. President this morning, he said, Gombe State government is really working very hard. So I don't claim good service, and if you know me, I'll say it the way it is. But it's very, very proud of you with the great work you are doing for your people.
Then, a fury of commissioning of health projects. The Federal Medical Center in Kumu, built by Gombe State, now adopted by the federal government, was the first. Then, several others followed in rapid fire. The 100-bed Women and Children Hospital, primary healthcare centers, and the crown jewel, the newly built 1,000-capacity College of Nursing. The First Lady, accompanied by the Coordinating Minister of Health, the Minister of Education and other dignitaries, saw these projects for what they truly are, the byproducts of visionary and purposeful leadership.
Today is indeed a great day, and I'm so glad I should be experiencing something like this. And this is just the beginning of the renewed hope agenda. We have to keep hope alive, and it's good to see a brand new campus for our nurses. And I'm really honored to be doing the official commissioning today, and I want to commend the governor. I know there are no speeches, but we're so proud, and then the best is yet to come for all our young people and our children. So this administration really want to work for you, the APC, and you know this is APC Nation, and that's what I'll call it, APC Nation. So it's really glad to be at home here. And to the glory of Almighty God, and to the benefit of our children, and even generation unborn, it is my honor and privilege to commission the Gombe School of Nursing, College of Nurses and Sciences. I'm really honored to be commissioning it, and I pray that all the students here will be students of excellence, and they'll go out and bless this nation.
The launch of the Flow with Confidence initiative of the First Lady became a theater of love. Teenage girls and women alike poured their affection on whom they described as the mother of the nation. Senator Oluremi Tinubu in turn played the role of a true mother, encouraging her girls to aspire and break barriers. Beyond the distribution of 10,000 bags of one-year hygiene packs, her fervent passion for education shined brightly.
I am delighted to be in Gombe State to officially launch the Renewed Hope Initiative, Flow with Confidence, a vital menstrual health intervention designed to empower our precious schoolgirls by promoting knowledge, dignity, and confidence through improved menstrual hygiene.
Menstruation. A bold, transformative effort aimed at breaking the stigma surrounding menstruation, educating young girls, and expanding access to menstrual hygiene products, especially for girls in rural and underserved communities.
True to culture, the warmth and hospitality of the people was lavishly expressed. A colorful gala night spiced with cultural displays. The traditional title of Sarauniya Yaki, meaning Queen Warrior, was bestowed on the wife of the president by Lamido Ako, while the Mekal Tungo honored the coordinating Minister of Health and Social Welfare with the title Baraya Yamma. The strong partnership between Gombe and the federal government was on full display during this visit by several high-profile guests, both for the Health Summit and projects commissioning. The first Gombe State Health Summit made significant conclusions and practical recommendations to solve contemporary challenges. The parting words of the coordinating Minister of Health and Social Welfare and those of Nigeria's First Lady captures their experience of Gombe State and her outstanding leader who has achieved so much in 6 years.
The commissioning of this hospital is not just the unveiling of a building. It is the opening of doors to life, to hope, and to a healthier future for our mothers and our children. Healthcare, especially maternal and child health, is at the heart of the Renewed Hope agenda of His Excellency President Bola Ahmed Tinubu, GCFR, which seeks to ensure that every Nigerian child has a healthy start in life, and that no mother dies while birthing life. It is my belief that this facility will provide quality health care services, reduce maternal and infant mortality, and bring relief to families in Gombe State and beyond. I thank the Governor of Gombe State, His Excellency Alhaji Muhammad Inuwa Yahaya, CON, and his lovely wife, Her Excellency Dr. Asma'u Inuwa Yahaya, and the good people of Gombe for naming this hospital in my honor. I also commend His Excellency for the commitment towards better healthcare to the people of Gombe State.
From a broken system to a model of resilience, Gombe's health sector has been built brick by brick, word by word, life by life. Yesterday's damages have been repaired, a stronger foundation laid for tomorrow, and a legacy secured.